good friend Paige from Advantage Athletic Therapy on the Queensway in Simcoe. My question today for you, Paige. First, how are you?
Good, thanks. How are you doing?
Perfect. When an athlete comes back after a serious injury and, you've got to start that physio component, is it hard sometimes to do athletes have this doubt because they're kind of afraid they don't want to get hurt again, but they want to get back? And how do you work that? Like, I mean, you're stretching and bending. I've seen what you do to people.
You've been there.
I've been there. So how do you mold that into confidence and get them going again and make sure they stick to the routine of doing what you've, assessed them needing to do to get healthy again?
Yeah, that can be a really tricky conversation and situation with patients, depending on who the patient is and what they're like. So I try and incorporate in the exercise program things that are going to mimic their sport so that they can have the confidence to know that they're ready. So worked a lot of rugby this summer. So for example, like, we're not rehabbing torn ACL and throwing them back in after 6 months. We're going through the whole rehab process. And throughout that, we're going to be doing specific drills that are going to mimic their sport. And then we're slowly going to get our way back into contact so that, their first time getting hit again isn't going to be on the field in the middle of a game. They're going to be doing that with their fellow athletes so that they build that confidence up slowly. And another thing is just, my attitude towards the client too, and reassuring them that yes, you are ready and you've done this to prepare yourself and you've put in the work. So the other thing is if it is to that extent where they're really cautious and nervous, then maybe we refer to someone who works in mental health to help them realize that for themselves as well.
It's got to be, I mean, I know you and your background and you're very, very busy athletic wise. So you already know what they're going through. You can have that better sense of what sort of happening to their bodies. Whereas maybe somebody that just went to the schooling and didn't participate in sports that much, that must give you an advantage, doesn't it? Because psychologically, you probably understand a bit better what's happening to them.
Yeah, I'd like to think so. Sometimes I find that I'm apprehensive now because of my knowledge. So I have to remind myself of that as well. But yes, it's very true. Like being able to relate to a patient, obviously put yourself in their position. You're going to be more empathetic towards them and hopefully be able to help that much more.
And you mentioned a torn ACL. How, like, that's a year, isn't it?
It is. Yeah,
Oh, like you start thinking in terms of that losing a year of your, but you have to, or else it's never going to heal properly. Correct?
exactly. Yeah.
Wow, I didn't. I actually, when you use that example, that was one of the things I'm like, yeah. Is that now with, for an example, just last question, I won't bother you, but when you're rehabbing something like that injury, is that a full year of physio?
It could be on and off, like depending on which situation we're in. When I used to work at the university, at some point we're going to hand them off to the strength and conditioning coach.
Right.
And so I would do in our clinic, I would find someone who I trust, like strength specialist that way too, to be referring that way. The only time that they would be coming back after a certain point is, if they're having any issues with swelling or range of motion or that sort of thing. But hopefully we're not spending a full year on my table. Otherwise we're having problems.
Good point. Yeah.
Yeah.
Okay. Any last minute advice? It's raking season. Snow is going to be coming. Any last minute advice for us old guys trying to get out there and do everything?
My favorite is just listen to your body and don't wait 6 months to come into me and say that you got hurt back in October. So it doesn't
It
sound familiar, does it?
some of us guys, it takes that long to realize,
Yeah.
right? And we're
But it's
not
not
we're
just
not the
going away.
quickest.
Yeah.
All right, Paige, I'm gonna let you go. Say hi to everybody in the family. Take care, and we'll talk again soon.
Thank you.